Welcome to this At the Elbow discussion with Steve Lowe, the president of KLAS, the most trusted resource for making decisions around technology in healthcare. Steve, welcome to this session of At the Elbow.
Hey, thank you, Thomas. It's a pleasure to be here.
Hey, so we first connected a few years ago. We started when we joined KLAS as an organization. I was surprised to learn that you have been with KLAS for 5 years, but you came from a totally different industry. Can you tell me a little bit about your journey to KLAS?
Yeah, I'd love to. And it's interesting because there's kind of a fun through line that at what might appear to be kind of a varied career. So I've spent time in financial services. I've also been a consultant. And what's interesting is kind of I start in both of those areas prior to KLAS. I started out, fresh out of college, working in the Big Four. And it was at a time when, I'm sure you remember, kind of early 2000s, right after the collapse of Arthur Andersen, because of Enron and WorldCom. And there was this, the whole industry of public accounting was kind of shaken to its core. I think everybody recognized, and what really shook, and it was a very impressionable time for me, as I just joined with KPMG. I'm fresh out of school. I'm a risk consultant with KPMG, and the word of the day and the thought on everybody's minds was trust, and how do you build and maintain an enterprise where somebody and the broader audience is bigger than your client, and there's a trust that needs to be cultivated and preserved and honored within that space. So I spent years working for the Big Four. And it was a great kind of start to a career where I started to find a niche for myself in places where somebody has to tell the story and stick to the story, even when it's the less convenient thing to do, right? So, whether it was my first year with KPMG, where I'm presenting, risk audit findings to an oversight committee, and they might not be happy about what we found. Or, you fast forward to today at KLAS Research, we have this same commitment to, we're going to publish a report, and some vendors are going to be happy about what it says and some vendors aren't. And the willingness to stick to the story and to continue to cultivate that trust that's been built and earned is kind of it's been a fun through line through my entire career. And something that I think, those steps kind of prepared me for. So when I found KLAS, a lot of the consulting I did back in the early years was in healthcare. But I think the work with the integrity of the message and being an arbiter of truth was probably what prepared me most to have an impact at KLAS. And it's been fun. I absolutely love those types of challenges.
And so that's a great pivot to really my next question, which I think most of the audience will be familiar with KLAS, but could you tell us a little bit about the overall mission of KLAS?
Yeah. So the mission is we want to improve the world's healthcare through transparency, insights, and collaboration, right? And here's what that means for us at KLAS. There is all this opacity in the market, and you've got health systems and payer organizations as well that are trying to make big, consequential decisions about their technology stack, about who they partner with. And nobody intends for these to be short partnerships, right? These are many, many years, massive investments and upon these decisions that the CIOs of health systems make, and the entire executive leadership rests the well-being of their patients and their providers. So these are high stakes. And what KLAS does is we believe we can bring, as I said, transparency to that. And the way we do it is just this really healthy research pipeline. So here at KLAS, we do almost 30,000 conversations every year, research conversations. And over 95% of these are in person, either on the phone or video call, where we're asking really deep questions about healthcare providers' experience with their technology. And you take all those tens of thousands of interviews together, and that's what generates and feeds the knowledge we have to share with the world about how are vendors performing on things like their training, their implementation support, their strategic partnership. And it's kind of a fun role we think we serve in healthcare, we're not the ones delivering care, we're not the ones building software, but if we can shine a light and help everybody understand the story of who's really delivering on their promises, then that's where we think we can do something meaningful and unique in healthcare. And that's what we chase. We chase the truth and then try to help everybody improve with it.
And you mentioned worldwide, right? The world's
Yeah.
healthcare. Can we're involved with KLAS in a number of different countries. Can you talk a little bit about your expansion beyond the U.S.?
Yeah, I'd love to. It's close to my heart because I actually grew up in Canada. So I'm both a U.S. and a Canadian citizen, but I two of my very own brothers practice medicine in Canada. And KLAS sees that the insights we collect, increasingly global healthcare technology is a marketplace that spans most borders. So, whether you're talking about Epic or Oracle or Fuji, Agfa, Sectra, you name it, like these are companies that really do operate globally. So while KLAS started in the US saying, let's do our research with American health systems, increasingly now we're conducting research all over the globe. So we've built up an international research team. We've got researchers speaking, I think our most prolific researcher knows 8 languages because he's taking calls in France, in Germany, in Spain, in Latin America. We're doing research in Arabic. So we're really seeking to be, and we don't cover the whole globe. So it's a fun growth mindset we're in right now, where we're saying, where can we find enough momentum in a place in the globe? Because there's a lot of regional energy. For instance, right now in the Middle East, there's a tremendous amount of investment in the Middle East with the modernization of their healthcare systems. And because of that energy, they're looking for some of that clarity that we think we can bring. So we've really ramped up our efforts in Europe and the Middle East recently to bring more insights to those places. So it's an ambition we have. We've got a long way to go. There's a lot of the globe that we haven't yet covered, but kind of a fun challenge to have.
I know for ourselves, we're working with KLAS in Canada, US, obviously, but also Canada, New South Wales, over in Australia, as well as the NHS. You've did a partnership with the NHS where you did a very broad measurement across a lot of their facilities. So
that NHS project was and continues to be one of our biggest measurements of clinician satisfaction with their EHR. It's a terrific partnership. We've loved working with them there, and by the way, it's always fun when we cross over with Goliath, because I think the insights and the transparency we bring is there's a lot of parallels in what Goliath does. So it's fun to bring complementary insights to a health system looking to improve.
Well, where we play is in the digital experience space, right? Yeah. And so, we talk about a single source of truth. It's hard to not tell the truth when you're literally reporting on the digital experience of clinicians. Yeah. Now, you mentioned something from your past background that's sort of a skills transfer, if you will, into KLAS, which is speaking the truth to leaders of organizations. Do you have 3 to 5 takeaways that from all of the conversations you've had with healthcare leaders as well as vendors? So you have the perspective of both speaking to those individuals that are leading health systems as well as the vendors that support those systems. Do you have a few takeaways that are memorable to you?
I love this question. There are, and I'll start with some humility, because what you're about to hear is a conflation of two things. One is, I read the research that we put out there. So there's a couple of reports we've done in the last 12 months, and some even within the last few months, that really have sought to get at I think the core of your question, Thomas, of kind of what are the kind of nerves that leaders in healthcare are feeling right now, right? What are the biggest challenges, and what's their mindset when it comes to investment, when it comes to the management of their systems? Like what are some common strategies we're seeing? And then, of course, like I have conversations with health system leaders, and we talk about what's driving their strategy. What are they, what are the approaches they're taking? because we're in a unique environment. So here's what I'm hearing, and I'd love to hear, how this aligns or contrasts with what you're hearing, Thomas, with your conversations. There's a focus on measurable outcomes and smart investments, and I think cautious investments. And it's not that health systems are dramatically reducing their investments. In fact, we've done recent research that actually a lot of health system leaders plan to hold steady or even increase spending on healthcare consulting services. And also they're looking to simplify their tech stack, but they're looking to deepen their investment with their chosen vendors. So we've seen time and again, and I'm seeing it in these conversations, kind of a heightened anxiety just because of the environment that we're all operating in right now. And you know the things we're talking about, right? Whether it's changes in federal funding, reimbursement, whether it's labor challenges and shortages and skill shortages that we're still kind of grappling with as an industry. So there's these pressures. What I like about the leadership that I've talked to, I think healthcare is blessed with a lot of tremendous leaders. I've heard so many of them express not like a resignation or a fear, but a resolve. So they're saying, yeah, we've got, there's some headwinds, but this is a challenge we can rise to. We'll use this stress and be more efficient. We're going to make smart investments in the right technology partners. So I don't see a lot of people stopping investment, stopping spending. They're just being a little more rigorous as they evaluate their partners, and they're looking to be able to measure probably in a more meaningful way than if you go back 4 or 5 years. I think there was an appetite for experimentation and a looseness about the willing to dedicate investment really quickly that we've seen evaporate. But that's not all bad. I think it's brought some discipline that healthcare is benefiting from.
And do you see on the vendor side that there's a recognition of that? And do you see it informing their strategies in any way?
Yeah. Oh, yeah. In fact, we have, now I want to be careful. I don't want this to sound at all self-promotional, so I'll do my best not to. But with some of the partners we've worked with, we've had vendors come to us and say, we've had this great experience with this health system or these health systems, and we want to be able to validate the return on investment. So within the last 8 months here at KLAS, we've started writing what we call ROI reports. And really it's an opportunity for us to validate in an objective third-party way and say, okay, let's see if we can prove from provider validation, right? We're not taking your word for it. We're going to validate these results, measurable results with provider, and then publish a report on that. And it's been fun to do those because the appetite we're seeing is on both sides. The providers want that because they want to see, hey, is somebody else engaged with this partner? And if so, what did they measure from their partnership? And the vendors, unsurprisingly, are saying the same thing. They're saying, we want to be able to prove to potential customers that we can deliver on our promises. And that's where, I used the language earlier, KLAS is an arbiter of truth. I think this is one of those scenarios where we can step into that void and say, you know what, if in as much as the market trusts KLAS, and I hope they do, I believe they do, then, they look at it and they say, well, if KLAS really, they did their interviews, they were rigorous, they've got the standards they've set for themselves editorially and statistically, then I can read this report and it can be a meaningful piece of information. And we don't want people, just seeing, hey, who won best in class? That's who I'm picking. Nobody should do that. But it sure is great if they read what we report and let that be part of the information as they make their strategic partnership decisions.
And in line with that, if you look at the overall goal of KLAS, the mission of KLAS, right, and Goliath as well, is to improve clinician experience with, I think, the understanding that the ultimate end goal is to improve patient care, right, healthcare. Can you tell me how you think you do that at KLAS?
Yeah, it's something we try really hard. Like your question is something that I think about as a leader at KLAS that's very important to do internally. Like any organization, we've got lots of different teams doing lots of different things. I want everybody at KLAS, and of course outside of KLAS, to understand how exactly it is that we see our actions resulting in a better patient experience. So the connection I make, and it's real, it's very real, is that as we drive that truthful story, we are helping. And my choice of language is important because we're not doing the heavy lifting, right? When we go and tell a vendor that their customers are dissatisfied, that their scores on, let's pick an example. Let's say their implementation scores have dropped and their customers are dissatisfied with how implementations are going. As we present that feedback, we see ourselves as an advocate for the provider. So we're challenging that vendor and saying, listen, you know what we do at KLAS. We're gonna publish, we're gonna tell this story, but we want you to hear and understand this story as best as we can help you understand it. So we're not here just to hurt somebody's reputation. We're here to help them to get better. And we love the partnerships we have where vendors say, KLAS, we want the feedback. We want to hear what our customers are saying so that we can get our product better. So our partnerships, we don't look at them as a marketing partnership. It's a strategic product partnership. And what happens if we do our job right, we're providing insights for these vendor leaders and health system leaders where they're able to elevate the technology experience for their providers. And if you've got, healthcare is funny because, those of us who work in it, we're all consumers of healthcare. So when you go to that next doctor's visit, if your doctor's back is to you and he's frustrated on his keyboard, that's a much different patient experience than if they're engaged, looking you in the eye. They've got technology that is seamlessly supporting that. You're not waiting as long. Your check-in is more streamlined. Your billing experience is more satisfactory. I mean, all these things, there's so much room for improvement, and the patient is the end beneficiary of that improvement. So we love that mission, that we play this small part, even though we're not the ones delivering care or even writing the code for the software. But if we can help those companies understand their strengths and weaknesses, then that transparency really raises the bar. That's what we do, is we want to help raise the bar.
And so on the Goliath end, we actually are taking a lot of the data. You say that you're not actually making the changes, so we're sort of more in the on the side of making those changes and taking action on them. Can you talk a little bit about how our two organizations dovetail, or how we might continue the KLAS story? Because we end up engaging in a lot of the same health systems in I think a very synergistic way.
I still recall, I forget how many years ago when we first met, and we were talking about, you were helping me understand kind of how Goliath really identifies and improves that clinician experience with the performance of their EHR. And I think the KLAS Goliath relationship, it may be one of the best examples of the question that you're posing of, how does it work well? And so when I think of like the Arch Collaborative, which but for anybody who doesn't, that's where we help health systems measure their clinician satisfaction. This is an area where we go in and we are able to help health systems identify how satisfied are their clinicians with their EHR experience. But then we start to measure various elements of that. Is there a performance issue? Is there a training issue? And a various number of other metrics that we look at. And then the beauty of what Goliath does, as I understand it, but you can fill in the gaps where, because you'll be better at selling Goliath than I will. But what I love is the transparency you bring goes 2, 3, 4 layers deeper, where our insights stop at, hey, the clinician's frustrated with their technology and there is a time problem, right? That's as far as we've gotten into. Then in steps Goliath and says, okay, now we can help you understand exactly where that's happening. Here's the quantification of it. Because what KLAS does, we quantify the sentiment, right? We have scores and we measure and we benchmark how happy or unhappy are these physicians. Goliath comes in and says, let me tell you in seconds and milliseconds how long it's taken them to log in. So all of a sudden, you're giving a greater level of depth to help improve that. And then we see it. So what's fun is, I know Goliath and KLAS, we are helpful to some of the same health systems. And as we measure year over year, KLAS does, the clinician satisfaction, We're just now starting to, see some data and evidence, and we'll be able to see, and of course, there's confounding variables, right? That it's not just Goliath that they're engaging to help them improve their experience, but there's some clear signals that we'll be able to pick up and see, where is Goliath having a big impact on clinician satisfaction, where you guys are partnered in areas that we're helping them measure. So I think that's fun for us to start to say, we've been able to measure something, and now we get to see how other healthcare vendors are driving improvement on that.
Well, KLAS has the concept of a house of success, right? And in that house of success, there are certain pillars. You can understand which must be achieved to have a solid EHR experience, right? To deliver a good EHR experience. And it occurs to me that when you're dealing directly with clinicians, sort of at the elbow, if you will, and getting feedback, you can pretty readily see that a clinician needs additional training or that an application workflow can be optimized. Mm-hmm. And that can come from a direct interaction. When you're asking a physician or a clinician overall to describe their digital experience, they can't give any details.
Yeah.
At the same time, in a much more precise way than sort of training and education and things of that nature, we should be able to see every clinician's digital experience, down to the location they're logging in from, their experience as they're using the application. So it's all known data. It's just a matter of focusing on that as the primary objective, which is trying to improve clinician experience and ultimately patient care, which is kind of where we extend your solution. Every one of the organizations that works with Goliath wants some better state than they're in, and many of them have measured with KLAS, and they have a distinct desire to understand those problems more fully and make changes. But speaking about clinician experience, it's something we all chase, right? We all talk about improving clinician experience. And as you mentioned, it's a many faceted type of a goal, right? It's a lofty goal, maybe like a golf score, never to be achieved the way you want, but can you talk to us, what are your thoughts on why it's so difficult to achieve a good clinician experience?
Yeah. It's such an interesting question, and I think it's part of like a broader question that I think we grapple with even as a society as we look at the challenges. Healthcare is really challenging, and we see that manifest in kind of rising costs. Like as a percentage of GDP, it keeps going up. America, we've struggled with what are the outcomes we deliver for the money we spend? How efficient or inefficient are we? And we benchmark against other countries. But I think the reason I bring those elements up is because I think it speaks to the same thing you're asking, which is why is the clinician experience so hard to get right? And as I think about part of this is just the practice of medicine. Talk about a high stakes situation that requires a combination of I think an elevated human touch at the same time as a profound knowledge of technical, scientific, medical knowledge required to do that job effectively. There are few professions that I think have quite that demanding a level of skill. And so you layer that into an environment where that the cost of a mistake is high, the financial pressures are high, and then you want to put technology in place where we have onerous standards, right? Like compliance and data privacy and protection, and you put all these pressures together, and what you've created for our dear providers is a situation that is hard to execute, gracefully. So I think there's so much more that technology can do to enable clinicians to have a great experience, but it's a tough environment, and I think that's why clinicians deserve our gratitude and our grace and patience. But it's also, I think, why elevated and thoughtful technology solutions are so important. This isn't, there are so many other areas, other industries where you can develop a technology solution. We see people now with AI, they're vibe coding solutions. You can't vibe code a technology solution in healthcare by and large for a number of reasons.
Right.
There's privacy concerns, there's security concerns, there's patient safety concerns. So, and don't get me wrong, I think AI tools will be very helpful to healthcare, but the level of experimentation requires a great deal more rigor in healthcare. So, I think it's a tough environment. What do you think, Thomas?
I think that it's a very challenging environment. And what I do notice over the last maybe 3 years has been an increasing awareness on the clinical side and the IT side that they have to work together to improve clinician experience. In the large majority of cases that we're involved in, you have both the clinical and the IT executives working together, trying to understand the root cause of particular issues and arrive at solutions that work for them, given the constraints that they're working under. So we're seeing that a lot. We're seeing a lot more. It used to be, you'd meet with a group of clinician executives, CMIOs, et cetera, and you'd meet with IT executives on issues, possibly the folks that are responsible for the applications, whether it's Oracle, Epic, Meditech, any other clinical application. And today we're seeing many, many more, and the vendors being involved. What I've been really impressed with, whether it's Oracle or Epic, is the extent to which the EHR vendors are getting very involved in the performance of the application, even when the performance of the application isn't the application itself, but underlying factors. And there's a recognition, I think, by those vendors that what organizations see on the screen, which is Epic or Oracle or Meditech, et cetera, is going to be, to the clinician, the root cause of the issue.
Yeah.
It doesn't really matter whether it's a network element or something like that, something in the delivery infrastructure. And so there's an increasing, I think, awareness and involvement by the various EHR vendors. And I just mentioned the top three because that's who we typically work with, but most of them, that they realize that the underlying infrastructure and delivery infrastructure is incredibly important to the perception of their product.
It's so true. I think gone are the days when they can say, "Hey, we just write great code." Like that's the level of partnership expected, fair or not, is very high, and it's we in the research we do, a part of our question set actually asks about the level of strategic partnership and responsiveness to challenges that go outside your traditional scope of, you're not buying software and then saying thanks a lot. This is a very deep partnership, and it's been, I think, an encouraging sign of the journey. And I think I'm hearing you say this as well. We're seeing it also, whether you're, whichever of the main EHR vendors you're talking about are increasingly getting engaged with the clinician satisfaction scores and embracing the fact that it's a holistic partnership in the platform, and the more they can help their customers be successful for the clinicians, the better that everybody will be in the long term. Even, so they're not as worried about saying that's my problem, that's your problem. It's a healthy partnership is good for everyone.
Yeah, and I know, you only have to be involved in a couple of conversations with clinicians when they're experiencing, for example, speed and reliability issues with the application in front of a patient, right? And that is where I think a lot of the stress, the burnout occurs, is when technology becomes something that they can't, that should be sort of invisible and an enabler of delivering patient care, but it becomes a challenge. And it's a challenge that they're not adept at dealing with, nor should they, right? Yeah. So that's what we're seeing, and we're very passionate, obviously, about improving patient care, improving clinical outcomes in the one slice that we can deliver on, which is giving full visibility into what clinicians are experiencing, and if they're having problems, identify where those problems are.
Yeah.
So closing out here, could you give us a little bit, now you have a broad base of experience, you're talking to all different types of people that are involved in the healthcare marketplace. Can you talk a little bit about what you see as maybe the top 2 or 3 opportunities going forward in the next 2 or 3 years?
Oh, that's a tough one. It's things are changing so fast right now that what is the topic du jour, yesterday has changed. So, but I promise I'll answer your question, or I'll do my best to. Over the last couple of years, we've seen tremendous energy in ambient speech technology. And what's interesting is increasingly that's being viewed as a commodity, which I think is a bit of a mistake. We're not there yet. And we've done a lot of reporting on some of the leading vendors in kind of ambient clinical documentation space. I think there still are differentiating strengths and weaknesses between those vendors in different spaces. And there's lots of good material out there, but both from us and from others on some of those. So that's becoming better known. Where I'm excited about where it's going is, and we hear a lot of energy, is how can these technologies help the rev cycle experience? Revenue cycle optimization and software to improve the efficiency of that, both for the payer and provider, is an area of tremendous energy that we're seeing and engaging with. And I think, if you go back a little bit, I think there was a fear that like the advent of AI chatbots was going to turn into like a battle of chatbots. Like it would be an arms race between payers and providers to see who could maximize the benefit of artificial intelligence to their advantage. And what we're seeing is not entirely negative like that. In fact, we collect at KLAS a lot of points of light where we're seeing in a positive way the process of kind of the financial reconciliation that needs to happen between a health system and the payer become more streamlined through the use of technology, and in some instances being done in a very partnered way. So that's an area that I'm excited about, that we see energy about, is kind of how does AI technology start to improve the revenue cycle element of healthcare, that payments are fair and timely and also judiciously measured. Right? We all have an incentive for that to work well as patients and as taxpayers. We want those elements of the system to work well. So that's one. The one other area that I keep hearing interest in, that's something that we're starting to get our research machine humming on, is virtual nursing. And I think this is driven by something I mentioned earlier in our discussion, where health systems are grappling with labor shortages, and they see the demographic future that we're facing, right? The demographic challenges are going to get harder, not easier. So they're looking to technology to augment what the wonderful nurses can do to help improve the patient care experience. So I think the virtual nursing is something I'm excited about. I'm hearing a bit of energy about it. What about you, Thomas? What are you seeing as areas of energy?
A lot of energy around AI for sure, but cautious. What I read a lot about is sort of out of our area of expertise, right? Is less AI for IT. What I read a lot about is the potential for improving clinical outcomes through research. I mean, there's some just the notion that AI can look at anonymized patient records over the last 10 or 15 years, pull that data together and find the precursors for certain diseases and things of that nature is pretty amazing to me. I mean, it's probably one of the most interesting things I'm reading. The notion of preventive care at scale, as opposed to being reactive and treating symptoms is just, I think, probably one of the most important things that could be an outcome of AI, is being able to prevent so many diseases, not just find cures, but prevent them. And I think most folks would say that in a lot of these serious diseases, early detection is incredibly expensive, right?
Yeah.
But it's also incredibly important. And the notion that we can arrive somewhere where preventive care is possible at a cost that's nominal is would be a great intersection between the advances in technology like AI and the advance in healthcare, and improvement in healthcare. So.
Yeah, I love that. I share your excitement for that. I think it'll be great to see, both, an ounce of, what do they say? An ounce of prevention is worth a pound of cure. And,
Yeah, for sure.
The early identification will be wonderful. And then, of course, the hope, and I think we're early enough in this, but to see, can new treatments be developed meaningfully? And I think, I'm not as plugged into this space as I'd like to be, but, I've heard, stories of breakthroughs that are, still early and need to be validated. But wouldn't it be exciting to see treatment breakthroughs that are enabled by AI and some of these models that can act agentically to experiment and augment the experimentation that happens? But that's the hope, right? I think just being consumers of the messages we hear in society, and I'm taking a step back from KLAS and Goliath. I mean, we're talking just big picture here. I think there's plenty of anxiety right now about AI and what it means for the future of the labor market and for our lives and our society. There are things to be optimistic about, and obviously, I think we want to be balanced as we consider threats and also benefits. But it would be wonderful to see some of those come to fruition in meaningful clinical outcomes.
Well, you know what they say, the old saying, an apple a day keeps the doctor away.
Yeah.
Well, I heard somebody say the other day that you could eat the entire apple tree and it's not going to be as good as a low cost preventive test. You know what I mean? So
yeah,
preventive care is going to outweigh whatever your diet is, be it apples or otherwise,
You know what's interesting about that, and this is personal, but I'm sharing it. So here you're going to hear a little bit of my medical information. I mean, and Thomas, you know this about me, but I love to ride bikes. I take good care of myself. I'm physically active. I eat pretty healthy. And I went in for my physical last year, and the doctor said, "Hey, your A1C is higher than I'd like to see. I'm worried you're on a path to diabetes," which was shocking to me because like I said, I'm pretty active and I eat well. But my dad and my entire family tree on the paternal side have type 2 diabetes. Like it runs rampant in my family. So that was a good message for me, like genetically that deck is stacked against me. Now, without the test, and then so I bought one of those over-the-counter Abbott Lingo sensors. So I wore a CGM for a month to actually monitor in real time my blood glucose. And it was just such a helpful experience. So your comment made me think of it because, some targeted tests told me something that helped me take low-cost lifestyle changes about my diet and exercise. And even though, I think without that test, any doctor would have looked at me and said, "You're healthy, you're
fine.
your BMI's fine, don't worry about it." When in reality, they're saying, "Hey, you are healthy, your BMI's fine, but actually you should be a little more rigorous about your carbohydrate intake." And some of these things so there was an opportunity for me to improve my health future through a low cost targeted test. And that's kind of a simple example. It's nothing, terribly innovative, although I think it is. Those CGMs are pretty cool. I connected it to my phone and geeked out over my blood glucose data for a month.
Well, it's important to note, right? The preventive care is trying to hide or find the underlying issues that are not necessarily obvious, right?
Yeah. Yeah.
So, well, listen, Steve, thanks so much for joining us at the Elbow, and we look forward to further conversations. And thank you and KLAS for everything you do for the healthcare industry.
Well, it's a pleasure. Thanks for inviting me to join you for the conversation. It's been fun.
All right. Thanks, Steve.
Bye.